unlike many other cancers, colorectal cancer can be prevented, which is a good thing. And Dr. Nina is here from GBMC to explain exactly how and the ways we can eliminate health problems before they happen. How are you, doctor?
I'm good. Thank you for having me.
Yeah, so for those who don't know, what exactly is colorectal cancer?
So colorectal cancer is cancer anywhere in your lower intestines or large intestines, and is a abnormal growth of tissue that can affect your health.
So what causes colon cancer, do you know?
So colon and rectal cancer has multiple causes, some of which can be genetic in nature. About 25% of patients will have a family history, although we've only identified gene mutations in about 10 to 15% of those patients.
Oh, wow.
There are also environmental or acquired factors that can also affect your risk, including things like dietary factors, low fiber diets, red meat in your diet, processed meats in particular we have found to increase your risk, smoking, excessive alcohol consumption, obesity, things that contribute to your risk of really all types of cancer.
So what are some of the symptoms that we should be mindful of?
So the first symptom is typically a change in bowel habits. Blood in your stool can also be a sign of potential colon cancer. Weight loss that's not explained or intentional, or abdominal pain are a little bit less common, but those are all things that you should have evaluated by your doctor.
So is there any treatment options out there?
So there are a lot of treatment options.
That's good to know.
And I would strongly encourage patients to come in for their screening colonoscopies, because this is one of the few cancers that we can actually prevent by removing polyps before they grow into cancers. We can also treat very early stage colon cancer with endoscopy. And beyond that, treatment options are typically surgical, so surgical removal of the area with the cancer, and sometimes also includes chemotherapy and radiation if that's required.
So what are polyps?
So a polyp is an abnormal growth of the lining of the colon, and they tend to grow over time, and as they grow, they acquire more changes, which eventually will become cancer. So if we can remove them early, we're actually removing something that will most likely become cancer before it gets there.
So obviously this can be scary, but the good news, it can be treated.
Absolutely, very treatable, and patients have very good outcomes, particularly if we catch it early. Early stage cancer responds very well to treatment, and patients typically have more than 90% 5-year survival rates, which are what we look at.
Nice. So the colon cancer, obviously it affects people, younger people versus, elderly people differently. Is that true?
It can affect them a little bit differently. The characteristics of some of the tumors can be a little bit different. It is more common the older we get. The screening recommendations used to be age 50. There has been a move towards recommending younger screening, particularly in the African American community, as well as really now they're expanding that to pretty much everybody. American Cancer Society decreased their age of recommended screening to age 45.
Gotcha. So GBMC, you guys always have such wonderful things going on. Talk to me about this new center.
So we just opened a brand new endoscopy center, the Crow Center for Digestive Disease, with an eye towards making the patient experience more comfortable and more pleasant as it can be when you're coming in for a colonoscopy, because we realize that it's something that patients aren't always excited to have done, but it is an important part of your preventative care.
Nice. So let's get into detail about that, how it is a different experience.
So we have recently opened this new center that actually has private patient rooms for pre and post-op. It has 7 treatment procedure rooms, which are all have the newest technology available, which makes the experience more comfortable for our patients, even afterwards, the recovery period, and just sort of overall makes it a easier experience for our patients.
Absolutely. Good to know. So where can our viewers find more information about colon cancer and, of course, GBMC?
Absolutely. So www.gbmc.org is our website. If you search for colonoscopy, you will find all kinds of information regarding that. If you put in /Crow Center, so KROH Center, that will give you some additional information about the new endoscopy suite that we just opened. And GI oncology is another searchable department where you will see the surgical team and some of our colleagues from the Cancer Center as well.
Well, thank you so much. It was a pleasure chatting with you.
It was
and I
a
learned
pleasure.
some new information as well.
Thanks so much for having me.
Awesome.